I understand that you've done 5 years of undergraduate training at least. You've done a year of foundation training, possibly some core training as well, and you've developed all these clinical skills which are completely unique and give you this skill set which allows you to diagnose and treat people with such a variety of different oral health conditions. Why would you want to go and do something that's so far removed from that? Well, I can only speak from a personal perspective, but I found that knowledge, that understanding and that appreciation of clinical management allowed me to deliver my knowledge to a wider group of colleagues across health and social care in a way which was meaningful, and allowed me to utilise my knowledge of dentistry in a way which brought about change to an entire dental system and an entire health and social care system, rather than just to one individual person who was sat in front of me. Now, when I took my training post, friends, family, colleagues, people said various different things. Why are you going and doing this? You know, like, is it because that you didn't like clinical dentistry? Was what I got a lot. And no, it wasn't because I didn't like clinical dentistry. It's because I found a way to deliver my knowledge in a way which I found more rewarding, in a way that was treating lots of people. I was accepted onto an oral surgery training post at the same time, and that was one of the most difficult decisions I've ever had to make. You know, do I pursue oral surgery, which I really enjoyed, or do I pursue this career which will allow me to, to use my knowledge and my understanding of dentistry to benefit many, many people? And that to me felt more engaging, more rewarding. People also said, maybe it's because you can't speak to patients, you don't understand how to communicate. Well, that couldn't be further from the truth. And actually in dental public health, you're speaking to people all the time. It appeals to me so much because it allows me to be so sociable with so many different people, from all the way from primary care providers, people working in hospitals, managers, policymakers, people who deal with commissioning and contract management. I engage with so many people on a daily basis, and I find that so engaging and so rewarding to be able to speak to these people, and then to find ways to deliver my knowledge in a way which is meaningful to them and means that they understand me and will help me deliver change in a way which is going to benefit large groups of patients. If that sounds exciting to you, then I think it's really important to try and reach out to dental public health colleagues to see if it's a specialty that you might be interested in pursuing. And this might be a local consultant or a local registrar. But if that's not possible, or these people don't exist in your area, then there are structures within the NHS which can give you a flavour of dental public health. So the local dental network, or your local dental committee, or managed clinical networks. All of these give you an insight into the cogs and the operational aspects of the NHS, and let you see how you might be able to enact change on the system. And it might give you ideas and insight into whether this is something you might like to pursue in the future.